Because you never expect when you see those pink lines that you are going to have a traumatic birth, that you are going to be in the NICU. And we had only been there for 75 days, and it was $1 million. My God, that can move mountains can fix a tiny heart. My God, that can move mountains can help Blair see.
Hi guys, welcome back to the Device Girls. I'm Sarah.
I'm Haley.
And today we have on a super special couple of guests. So today is sweet little baby Blair's first birthday. So we have Blair and Makenzie Ballard on with us today. And we're so excited to deep dive into Kenzie's very beautiful testimony, Kenzie and Blair's very beautiful testimony and journey through the NICU. And so I'm going to open the floor. Kenzie, why don't you go ahead and introduce yourself?
Okay, I'm Kenzie Ballard. This is Blair, and I actually reached out to y'all about telling our story. I feel like our story is very impactful because you never expect when you see those pink lines that you are going to have a traumatic birth, that you are going to be in the NICU. All you see when you find out you're pregnant is, I can't wait to have this baby, and the baby showers and the bumps and all those things, and our story is not that.
Yeah.
So, yeah, it's been a story, I feel like, of persistent faith and perseverance and just continuing to having to advocate for her and for us and to heal together.
Well, that's amazing.
Yeah.
Well, do you want to walk us through, you and your husband found out you were pregnant, and when was kind of the transition for you that there was a bit of a scare?
Yeah, so I had a great pregnancy with her.
Okay.
The only thing that I ever struggled with was just having morning sickness all the time. But I did that with my first pregnancy too. So nothing was wrong with her. So I flashed back literally a year ago to these days. I remember feeling weird, down there, but everything is weird when you're pregnant. So it's there's discharge. There's gross things happening to you all the time. So it's what's one more thing?
Yeah.
But I remember being sensitive, and it was on a Saturday. We had the best family day. We were at my in-laws' pool, just talking about baby shower and what we want to register for, and all the amazing things that are going to be happening in the next coming months. And I need to get my classroom ready because I'm a teacher. And then Sunday, I woke up and I thought that I was just having some cramping. And I was 23 weeks at this point.
Okay.
Never in my wildest dreams would I have thought that I was having contractions.
Really?
Yeah. I just felt so bad that day, and it came out of nowhere. And so we called the emergency line, and that nurse on the emergency line said, well, you might have a yeast infection. Go get this medicine. If it doesn't get better, you can call back. So we went and got the medicine and did that, and still just felt horrible, taking Tylenol, something was wrong. And then I called one of my friends who's a NICU nurse at Harris. And I talked to her, and she said, if you are scared for you and your baby, go to the hospital. The worst they can do is just turn you away. And so it was around 5 o'clock in the evening. I had been having contractions all day long, not knowing they were contractions. I was just thinking I was cramping. And I think I was just being naive. And we get in the car, and I try and call my mom. But it's 5 o'clock, so she's going into church, Sunday night church.
Yeah.
So she didn't answer, and I called my dad, and on the phone I said, Dad, we're going to, and I'm bawling hysterically. We're going to the ER. Something's not right. Something's wrong. And he's just trying to he can't be scared. Right. He's trying to be it'll be fine. I'm gonna call Mom. We'll drive up there because they live in Abilene. We live in Weatherford at the time. So I finally get a hold of my mom. They drive up there. I get into the hospital. And when you talk to the reception lady and you're I'm pregnant and my stomach hurts so bad, you get to go back immediately.
Really?
You get, yeah. especially like given how I was too early to go to labor and delivery.
Mm-hmm.
So they sent a wheelchair and we like go through the depths of the hospital and go to labor and delivery, and they triage me. And they start doing their assessments. They check me. I'm at like a 1.5.
Okay.
Already dilated.
Wow. Okay.
And just like hysterical. We end up finding out I had a, what is it called? UTI,
Okay.
which is what triggered everything.
Really?
Mm-hmm. So I personally think, like, no one's told me this. I think my UTI had gotten so bad that my body was trying to miscarry.
Yeah.
Like, that's just what makes sense in my mind, because your body, like, goes into self-preservation mode. Like,
Yeah.
we have to get rid of this so that we can be okay.
Right.
Because at that point, my water had already broke. Or it was leaking.
Okay.
I had preterm premature rupture of the membrane.
Oh my gosh.
I get started on magnesium,
Mm-hmm.
which if you've never been on magnesium, makes you feel horrible. Like,
That's what I've heard, yeah.
horrible.
Mm-hmm.
Throwing up, just so bloated, so inflamed. I'm getting steroids. I get steroid shots for her lungs just in case she comes early. Like, this is going to give her a head start on her lungs.
Okay.
And at this point, I am calling my school and saying, I'm not going to be there.
Yeah.
Like, I had taught the first 2 days of school.
Yeah.
Like, you're going to have to find someone else. Maybe I'll come back later. I don't know.
Mm-hmm.
Bless you. And they...
Bless you.
I end up, like, going into a room, having to track our contractions. She's still fine. Everything with her is fine. Like, heart rate.
Wow.
She was not the issue. I was the issue. Because I believe if my UTI would have gotten treated, we would have gone to term.
Yeah.
So
did you know at all that you had a UTI, or because you were pregnant you just
because
felt...
I was pregnant, I was like, and I don't have time for a UTI.
Yeah.
Yeah, you're like...
I don't know I didn't know a UTI can cause me to go into preterm labor.
Had you had one like before that? See,
No.
I used to get chronic
Me too.
UTIs as a little girl, and like as I got older, I mean, I don't have them now, but like as I got older, I wouldn't know I would have them for
Yeah.
so long until, and I've maybe like as an adult gotten some sporadically, you know, just like randomly. But honestly, those ones when I have, like one of them I was hospitalized with because it had spread to my kidneys.
They're horrible.
I was in so much pain, like my back. I mean, but I just didn't even know I had one until I knew I had one, you know, and like you're in the hospital with it.
Like, I remember feeling a little uncomfortable, but then it would go away, you know?
Yeah.
It wasn't, she's like, I'm going to eat this card. If I would have, in hindsight, if I would have known, I would have gone to an urgent care, called my OB, like gotten treated.
Yeah.
But yeah, like once we were in the hospital, I eventually find out you are not leaving the hospital. And I'm 23 weeks. Like, I still have 17 weeks, 4 or 5 months left of pregnancy. And at that point they said, you're not leaving anymore. You will go on to antepartum for the rest of your pregnancy until you have baby. So that's like I don't have bags packed. You mean I'm not going to see my kids? I'm not going to see my dogs? Like, my life is different now. She's like, I want to be your best friend.
Hi.
And you can
Come
live
over
there.
here.
I know, she can hang out with you.
I'm trying to turn this.
And like I'm in the hospital bed for 4 days, like talking to neonatologists, doing like all the checks, still on magnesium, have a catheter in, all the things. We get to a point where I'm feeling better. I'm dilated to a 4 now, but you can stay pregnant. It's fine. We have people on antepartum who are at a 4 for months. It's fine. We have people whose amniotic sacs have broken, but they can stay pregnant. You are fine. So I got to a point where they said, okay, we're just waiting for a room in antepartum to come up and then we can transfer you.
Okay.
So then she's finally like, we're going to take the catheter out. Like, you can get up, go to the bathroom, take a shower because I hadn't showered in a couple days and my room didn't have windows. So like, it was just dark and dreary in there.
Yeah.
I know. What are you doing, sister?
Here you go.
And I went to the bathroom and I remember wiping and feeling something And I called my husband. I was like, Ty, you have to, I don't know. I don't want to pull on anything. I'm scared. And he comes and looks. He gets the nurse. The nurse looks at me and she said, you're not getting up anymore. You will not get up for the remainder of your pregnancy.
What was it?
It was my placenta.
Oh,
It was PPROM, preterm premature rupture of the membrane. We had thought that my rupture was high, and obviously it was low, and that's what was starting to come out.
Okay.
So at that point, you will not get up anymore. And I remember just being like, I can't do this. And that night, like, I guess on the 13th, my contractions had really spread out at this point. And we were having a really good day, even given like the bad things that had already happened. Family came and visited us. I remember my sister-in-law brought me like a basket of all my favorite things, and me and my husband were like playing Mario Kart because you're just trying to bring some light into a really dark situation. Yeah. And then we went to bed, and I had a clicker for every time I had a contraction, and I kept clicking. Ty was already asleep. The nurse walks in. She's like, "You just been clicking. I just want to check you."
Yeah.
And I'll never forget, like, it's a little, kind of graphic. I feel like all of this is graphic.
Okay.
She goes to check me. And so you're expecting like this. Her hand did this. And so I'm over there, and you can see her hand make this motion and not this motion. Yeah.
So
which means I'm not at a 4 anymore. She said, you're at a 10. We're having the baby right now. And that was at 11:46 at night. Waking Ty up, and him being like, him calling our parents, going to the OR, and from the time we entered the OR to the time we left, we were in there for 8 minutes. I had her vaginal with no medicine, because I was on antepartum. I didn't need medicine. Right. We're in the OR, and I remember like there's tons of people in there. The neonatologist, his name was Dr. Mao, and he said, "Hi, I'm Dr. Mao. I'm gonna take care of your baby today." And so calm, like I'm freaking out. He is so calm, and I'm on the table, and the doctor says, "When you have another contraction, I want you to push." And I just remember saying like, "I have to pee." And she goes, "I would push right now." And so I'm pushing. I think I pushed like 3 times. She like lifts her up, shows her to me. In my head, the whole room is pitch black besides her. She is the only one who has light on her. Everything else is dark. And she shows her to me. Immediately, Blair gets rushed to the neonatologist, and all the NICU nurses are already there. They're intubating. Doing all of the things, and Ty is like running over there to go look at Blair, but it's not like, "Oh, our baby's born." It's, we gotta save her life.
Did she cry at all or anything? Did you?
I don't remember. I don't think so, because her lungs weren't developed at all. I'm telling you, she was the size of my hand. Aww. She was born at 523 grams. So 1 pound, 2.5 ounces.
Oh my gosh.
11 inches long. So a skinny jelly bean is what she looked like. And then I'm still on the table, like no idea what's happening behind me. We give birth to her, and then they do the fundal massage. So they, after baby's born, okay.
I am
pushing
with that. Yeah,
pushing the placenta out. That is the worst pain I've ever been in my life. Like, having her was one thing. Having someone push on you the second after you've just done that, horrible.
Wow. Did you have that, Sarah?
Yeah, they have to like make sure that they get everything out. It's very uncomfortable. I was also, did you have an epidural of any sort? Okay, so that's
I didn't have any medicine.
Yeah.
We thought I was on antepartum.
Okay.
So I mean, I got administered medicine like through my IV and stuff, but I wasn't on
Yeah. Well,
anything to help.
I can't even imagine because I know, like, for me, it was uncomfortable.
Yeah.
You know, it was a very uncomfortable
It's
experience.
not-
But I mean, I did have an epidural, and I was, you know, pretty heavily
Sedated, honestly.
Sedated. Yeah.
But then everyone like gets Blair taken care of. She's gone at this point. They've like taken her to the NICU. I get back on the table, and I'm just in shock. And I remember asking Ty, like, why did they have all the lights off in there? And he goes, what are you talking about? It was lit up in there. They did not have any lights off. And I said, I don't remember there being any lights on. And like, come to find out, when I've like talked to my therapist about it, she's like, that is trauma. That is the definition of trauma, is that your mind slows down to see everything frame by frame and like cancels all your other, like all your peripheral out, like, so you can only focus on one thing.
So when was it for you that was like your first experience getting to hold her?
11 days later.
Nuh-uh.
Yeah, so walk us through like the transition from giving birth to those 11 days.
Okay, so first off, like, we get back into our room, and I still don't know how to cope with the fact that you were pregnant 1 second and now you are not pregnant. And I remember telling Ty, like, I wish I was pregnant so bad. I want to be pregnant so bad. I still have that craving to be pregnant again. I would love to have another baby at some point. I'm just not ready for that.
Yeah.
Right now. And our parents walked through the door, my parents and Ty's parents. I had her at 12:04, so it's now like maybe like 12:15. Our parents walked through, and I remember seeing them like all poke their heads out and saying, I just had a baby. And just like, I just had a baby. And she's not here. And they all come over, and they like, my mom said, we're going to pray for her right now. And my, like, the faith that she had that it was all going to be okay was something I did not have at that time. And she came over and she prayed, and just like the most powerful prayer you've ever heard. And my dad said that the nurse who was like in there working, like, just like was stopped in her tracks and was just sobbing. So then after that, I get moved to postpartum, and I don't get to see Blair until about 2:30 in the morning, because they want me to pump first to start trying to lactate.
So you haven't seen her at all since?
For 2 hours, roughly. I had to pump first, and I like was able to get, I think, like 5 mils of colostrum, and they were like, this is incredible. Like, I cannot believe like you got this much milk. And so we took that up to the NICU.
See, and I'm not even familiar with like with that, and like how long, I mean, until you're like really ready, like, and your body's really ready for you to actually, like, you know, you're fully, it's produced the word, like you're to where you're like, because it's you're ready to.
You weren't really far enough along.
I was
to have
23 and 6 when she barely.
I 4 minutes. I want to look that up because I don't know when like the window is for like you to kind of
to start lactating. Yeah. I was always like with my first, I was a very like overproducer.
Okay.
So I knew that I would be able to make milk and
that's awesome.
That's incredible.
We were able to take it up there, and she's in the NICU. I think our first picture is at 2:36 a.m. with her. And the incubator is like, has a lot of condensation on it, and she's in a bag, which sounds weird, but it looks like she's in a Ziploc bag, honestly. Really? But it's to replicate the placenta.
Okay.
Because like she's been in such shock too. And there's a lot of condensation, We can't touch her. She only gets her cares every 6 hours. So that is diaper change. And then you think, she needs a diaper on? That's something that was really hard for me to think. Like, we're changing her diaper? What do you mean we're changing her diaper?
Like she's not grown.
Yeah.
She's not big enough to wear a diaper. And her diapers, she wore P3s, and they're about the size of my palm. I almost wish I would have brought one.
Oh my God.
And then all of her lines are out of her umbilical cord right now. And she's intubated. And she immediately gets her first picture, she has a beanie on to like keep her warm, but her eyes aren't open.
Yeah.
Her skin is sticky when you touch it.
Mm-hmm.
It's jelly, and she is so red because they've been giving her blood transfusions. So then next day, right? Like, still just in shock about everything. I remember we go up to the NICU, and our doctor, Dr. Shaw at the time, I remember like just, what does this mean? What does this mean? Like everything's beeping in there because we were in a pod. We were not in individual rooms. So our pod, imagine like at the front center is nurses' tables, and there's probably 7 or 8 beds around. So you're hearing everyone's sounds, everyone's noises. And she is in her spot, and our Dr. Shaw was like, you have to stop. You stop looking at it. It's going to turn yellow. It's going to turn red. You cannot stare at that. And being like, but I have to. And he said, there are 3 phases to this journey you're about to go on. And it is the first 2 weeks, Blair has to realize that she's alive. She's in a honeymoon phase. Like that first 24, 48 hours is a honeymoon phase where her oxygen was at like 26%. Like she's doing good.
Yeah.
But then her body is going to realize that she is not in utero anymore. And so she's got to have the will to live. Stage 2 is her lungs. It's all about her lungs and getting her breathing, and what does that look like for her? Because that could look like having a trach, which is terrifying also. And what that's all going to look like. Stage 3 is feeding, your feeding journey, which can be the longest because you're so ready to go home. And we're still on our feeding journey. So I had gotten discharged. I had went to the hospital every single day, and I sat and I did her cares, and I sat by the bedside and just was like, when do you think I can hold her? Yeah. I don't know when I'll get to hold her, and I'm scared to hold her.
Yeah.
Because she's so fragile. And the first time I got to hold her, our nurse's name was Kaylee. I love her. She's incredible. And I was like, do you think we can hold her? And she said, yes. You good? Woo! Crazy. She said, yeah, you're going to hold that baby today. So she rounds up everyone. You're getting RTs together because she's still intubated. And you're getting extra nurses, just extra hands, just in case. So I'm in my chair, and I'm literally like, okay, I cannot move.
Be a robot.
Kaylee is moving Blair over. Then you have RTs who are moving lines over. And once she's on me, then they are taping everything to your arm, and they're saying, like,
don't move.
Don't move. Don't move, because her intubation line is now attached to you. And then we got set up, and we finally got to hold her. And I remember being so tired because it was finally like, oh, I have her right here. Finally, after 11 days, I finally am holding her. She's real now.
Right.
Yeah. And then Ty got to hold her the next day. And then I held every day as often as I could. For the longest time, you could only do 1 hold a day because she was on like such a low stimulation. But then we got to where you could hold her multiple times. I started to be able to get her out and sit down by myself. When she got extubated at 46 days, that was a miracle.
Wow.
I remember my doctor, Dr. Grubbs, he called me. And anytime you see the NICU phone number, you just answer, and you never know what the news is going to be. And he called me, and he said, when you come in today, she's going to look different. I was like, what? what do you mean? He goes, we took her tube out. She's not intubated anymore. And just, like, thank you so much. Mm-hmm. I am so excited. I was so proud of her. Mm-hmm. Ugh.
So my question is, were you okay after giving birth? Were you still sick?
I was fine.
You were fine?
Mm-hmm. I was on antibiotics for the UTI. I was fine. I was up and moving the next day. Like, my first pregnancy, I had a C-section, so this was way easier. And mentally, no, I was not okay.
Right.
Physically, yeah, I was fine.
So I guess what was the process after, like, they extubated her? Did she still have to stay in the NICU for other reasons? Like, how long were you guys there total, and what did that journey look like as far as, like, I don't know, medical conditions, what they were treating, things like that?
So we were in the NICU for 195 days. We stayed at we stayed at Baylor until the end of December. So from August 14th to, let's say, like January 2nd.
It's like a half a year.
Yeah.
Wow.
That's like, I love the nurses that I had because they became my friends.
Family, yeah.
They became family, like, and we wouldn't just talk about, like, Blair. Like, we would just be friends, and that was so important. They were treating, so she has chronic lung disease, which sounds terrifying, but you think, like, her lungs were the size of a bean, like, and all that tissue is not healthy. So getting her to a place where her lungs could grow safely,
function.
So once she was extubated, she was not breathing by herself. Then you start going down the, like, me and the RTs, you get close, because they are the ones who do all the breathing stuff. And we went to NIPV, I think is what it is, which is kind of like a CPAP.
Okay.
And then you go to CPAP. And we were on CPAP for a long time, and she hated it because it's the mask, and she has that little hemangioma here, so it would, like, press on that, and then they would try and do the prongs, which, like, went up her nose. She hated all
Not
those.
a fan.
And then you go to high flow nasal cannula, low flow nasal cannula. You can go home on low flow nasal cannula when you are at less than a liter of oxygen.
Okay.
So she went home on oxygen. So her whole journey, like her whole time in the NICU, she was on some sort of breathing. What else? When we were there, she had gotten a UTI. She had gotten 2 UTIs. She was getting spinal, like, lumbar punctures done. She was getting her blood gases taken all the time. She has ROP, which is retinopathy of prematurity for your eyes. So when you are born so premature and you're on artificial oxygen, it causes the vessels in your eyes to, like, kind of, like, go corrupt. Like, they grow in a manner that is not suitable for vision, I guess. So your all those veins start, like, at the front center, and then they grow to the back of the eyeball. Her veins, we had to get shots in her eyes, Avastin shots, and that caused all the bad blood vessels to go away, and, like, crumple back in, go away. So
and
that
they
new
put
blood
her to
vessels,
sleep for that?
No. And we still get this done regularly. She's like, oh, that's a delicious shoe.
They are new, so it's not like they literally have not walked anywhere besides up the stairs here.
They give, like, dilation, eye drops, and then they put a numbing drop in. And then the eye doctor comes in to do this. Little prongs that, like, go underneath the eyelid, separate it, so then it's just, like, eyeball. And then they have a tool. It looks like a little spoon that manipulates the eyeball, so that they can look in the back of the eye.
Yeah.
So we got that done. She was getting that done once a week for a long time.
So she'll be able, like, she can see.
She can see
now.
Yes. So one of her eyes is better than the other. We went in and did laser when she got to stage 2, so the veins were able to grow where she'll have about, like, this much vision, like this peripheral. Mm-hmm. She doesn't have this back area. Yes, you can give that to her. And she said, oh, yeah, that's delicious.
Sarah's mom mode over there.
I know. So then you stop those bad blood vessels from growing. But then she had to have another eye surgery for her right eye? Yes. Where they go in to the eyeball. The retina specialist does this. And they had to, like, cut away some of the bad blood vessels, which left a little scar by her, what is that? I don't know.
In the iris? Or
no, it's the big vein, the optical nerve.
Oh, okay.
Yes. Oh, wow. And then they had to, like, put a little air bubble in there to, like, so if you look in her right eye, she has, like, a little scar where they went into the eyeball and did that. But then what was scary when they did that is they said she could get cataracts from that. So then you're worried about your baby having cataracts and then having to get a lens replacement. Right. And you're good.
Wow.
What else? Yeah, there's a lot.
You mentioned the little
hemangioma right here.
What is that?
So it is a collection of, sorry, she spit up on you. She has a collection of blood vessels. This is also a super common thing. It's not a preemie thing.
I've seen it before, yeah.
Yeah. And it's just like bad blood vessels that grew.
Okay.
And so they go through an evolution phase and an involution phase where, like, it gets really big and then it goes away. So it should be gone by the time she's 2, 3.
Yeah.
And we are actually on propanolol for it.
Okay.
But it's crazy. Propanolol is a medicine for your blood pressure. But it's a beta blocker, so it stops it from growing. And so we see a hematologist for that. We see pulmonology, retina specialist, endocrinology. Something else that was crazy is at the end of our NICU journey, she had a pseudo-menses. Exactly what it sounds like. It is a fake period. She had 3.
Really?
Yes. Oh, wild. And it's a common thing. It's not super common, but it's also not uncommon. Mm-hmm. So she literally had 3 menstrual cycles.
So what causes that?
Just like a change of hormone. Okay. Just like, it's a premature thing. Mm. And so I remember the doctors and nurses were like, oh, she's going to be a little irritable for about 3 to 5 days. She's going to have some cramping. And I was like, I know what a menstrual cycle is. Like, I know.
That is wild.
So we had to see endocrinology for that. And it's gone away. Like, all of the symptoms for it have gone away. Because it literally, like, she was having those symptoms.
Wow.
But yeah, it went away. It shouldn't affect her long term.
I've never even heard of that before.
Wild. And that was right before she went home. That's
crazy. So what you were talking about, like, her feeding journey now, and things like that, but what does everything look like for you guys with her moving forward?
Okay, so we still, will you hand me her bottle? Uh-huh. I feel like I could show. Do you see how thick that is?
Yeah.
Yes.
It is at a honey thick consistency.
Okay.
Because she is not safe to swallow liquids that are thinner than honey. So
Really?
Yeah. We go, like, before we left the hospital, we were seeing speech is the one who kind of comes in, or like your SLPs come in and make all those decisions about how she's going to eat. Because she had gotten a surgery around her esophagus because she was having, she had some flappy tissue. So her epiglottis wasn't completely, sealing.
Okay.
So when she has that thin liquid with her uncoordinated muscles, she has trace aspirations.
Yeah.
So when we go get our swallow studies done, you can see that even when we move to a nectar consistency, she's still aspirating. So we go see ENT to go talk about, what that means. Do we need another surgery? Do we just wait it out?
Yeah. So for that, then, do you just mix, oatmeal or rice?
So we've recently moved to mixing oatmeal. It used to be, because I pumped for 8 months with her, and it used to be defrost the milk, and then She said, I want all those things.
They're so much cooler than her toys.
Defrost the milk, warm it up to 122 degrees, like which is hot. And then mix in gel mix vigorously. Mm-hmm. Let it sit for 10 minutes. Then you could feed her. So it would be like 25 minutes to get a bottle ready. And wow. She's like, I'm starving. Mm-hmm. So we've kind of like moved away from gel mix recently and are thickening with oatmeal, which is also like helping her because we have to fortify her milk too to get more calories in. So like it sounds scary. You learn how to do it. It's not hard.
Yeah.
And now like I can truly just like eyeball how much she needs, or like this is probably a little thick. I would add some water to it. But she is eating purees because they are thicker than, But
so is she allowed to like start like baby food, like just like some solids?
I haven't done like the puffs or anything with her. But yeah, like she eats like full on purees too, like sweet potato purees and
good.
And I could even like mix it in with this and give it to her that way.
Yeah.
But we got sent home because she was like so close to finishing all her bottles when we left. You have to be at 70%, taking 70% of your bottles for 24 hours in order to get approved to go home. And we were like right on the cusp. And so they sent us home with an NG tube. So we had to learn how to insert NGs and where they go. Like they go above you find the xiphoid process and you have to do all that. And we're not medical people.
Yeah.
And like, but you learn all these things. And then I was setting up her pump and feeding her that way. And then now we don't really use our NGs anymore. Mm-hmm. It was only to supplement what she didn't take.
Okay.
And now she's doing awesome. And
that's amazing.
So it's truly like we went from not knowing if she would survive to like watching her try and crawl on the ground right now. Mm-hmm. And you can't tell me like God doesn't exist in that NICU because it is so evident. Mm-hmm. Every day it is so evident.
How do you feel like that shaped you as a mom, like having to navigate learning all of that and do all that, especially
it's
like
a lot.
Coming from having two other kiddos who like you didn't
had no medical issues. Yeah, no. It has like I think changed me from the inside out. Mm-hmm. I have just like really had to step up and learn it all and know what all the numbers mean on the screen and be able to recount her medical history when it like to whatever specialist we're seeing and like stay up to date with her. How much medicine are we getting? How many times a day are we getting it? Have we done breathing treatments? Do we have enough oxygen in the car? Did you bring a fresh NG tube, the tape, the lube, the like all the things in case she pulls it out that we have to reset it. So it was a lot. And I remember asking my pediatrician, like, can you please give us a handicap placard? Because I'm having to trudge across the parking lot with carrying her oxygen, carrying all of her stuff, and trying to like push a stroller. I was like, please, I just need one. And so obviously like we got one.
Yeah.
And now like.
As you should.
Yes, as we should. And now we don't have to use those things. We actually had a visit with pulmonology yesterday, and they discontinued our home health supplies for oxygen, which is incredible. Wow. Because we got sent home on a concentrator. So she was connected to tubes at our house, like where she could only go this far in one direction.
Yeah.
And then like maintaining those machines and which is nothing compared to like if you got trached.
Yeah. Yeah. How have your other children like helped cope and like coped and then just helped and like kind of transitioned into this with you?
So the 195 days we were in the NICU, I was there every single day, probably besides 10 days. And in those 10 days, I had strep throat, I had an emergency appendectomy, and my daughter had RSV. So if I wasn't there, it was because there was like a medical, like there was something going on that was not letting me be there. So my husband, oh my goodness, he is incredible. He like fully took on dad mode at home so that I could go and be with her because I also didn't go back to work after that.
Right.
So then like we're losing an income.
Yeah.
he's doing everything he can do at work, like whatever side job he can do, and taking care of the kids. I am at the hospital with her carrying that mental load all day. Mm-hmm. And then I would come home and just be like checked out. Like I just,
oh, I bet your baby.
The depression, the anxiety. Yeah. And then like I just wanted to snuggle like my daughter Blakely and talk to Wyatt. And so I noticed they like really clung on to Ty during that 6-7 months we were there, as they should have, because he was the one who was home. I wasn't home.
Right.
And then when I was home, I wasn't there still, you know, like mentally I couldn't be there. And because it's like you're just like turning a key, going from this, now we got to try and be present and do all the laundry and do the cooking. And so like I really struggled. I never wanted to cook. I was never hungry. And just like I want to be alone for a minute. Like I need to be alone and with my own thoughts and like cry about it or just like turn everything off from the day. But now like Wyatt, he's so cute. He's my stepson. He's 10 now. And so he didn't really understand what was going on, but he got to hold her and it was just so pure. He wanted to hold her so bad. And I remember saying like, when you hold her, you have to be still for 1 hour. Like, you have to be still. You can't be fidgety. You can't chew on your fingers. Like, you have to be still. And so he was like, okay, I can do it. And so I took him up there and sat him in the chair and we handed him Blair. And just like to see someone so innocent looking at someone else who's so innocent, like just like brotherly love. Like he just loved her. He loves her. And I remember he's holding her and he just is looking at her and he goes, Kenzie, I don't want to move. I don't like, she's so beautiful. And just, he's been so good. And he was always great with Blakely too, but it's just sweet.
It's different.
It's different.
Yeah.
Because he kind of understands and he knows like, oh, Kenzie's not at school. Like should be down the hallway, like at school with me right now. And so, and then my school did a lot of stuff for Blair. They like these bracelets. One of my friends at school got these made, and so the kids could buy these, and then they donated all the money to us. And it says Blair Ballard, tiny but mighty, and it said Jeremiah 1:5 is on it, which is about God talking to Jeremiah and saying, "I knew you before I formed you in the womb." Like I knew who you were going to be before I even put you there on this earth. And then my school made shirts that everyone wore, and then they donated money. They did hat days that they donated money to, just to like make it feel like I think Wyatt felt really supported that way. And then my daughter Blakely, like she's loved having little sissy. Yeah.
What? I guess I'm curious on a different perspective. What was that like for your husband as well? Because, like, I know you're mom, you're pregnant, you're going through this, but he's just kind of watching it all from the outside.
He's going through it just in a different way.
Yeah. And I think, like, because he had to watch all this happen. And I remember him telling me when we first, like, we're going through it after she was born. And so he had finally left the hospital and he said, I just went home and I just cried. Like, and I cried the whole way home and I just laid on the floor in our living room and I just sat with our dogs and I just bawled because he couldn't do anything. And he was very adamant about, like, I don't want you to go back to work. Like, you where you need to be is at the hospital with Blair. Because I was just so not okay.
Yeah.
And I think it was hard on him to see me that way, to like, and then also having a daughter going through all this and you can't, he wants to protect, he wants to fix, and this is something he can't fix.
Right.
So I think his journey is a little bit different than mine because he would do so much of the at-home stuff. He would probably go up like 2 to 3 days in the evenings to go see Blair and hold her. But yeah, now everything, like, now we just get to be mom and dad and we have a normal little baby at home and it's different. And he's not really like coping. I almost feel like I've gone through like a second postpartum, like reliving everything that's happened, because it'll like hit me sometimes, like when we go to Cook's and I walk by our room and like I see the window and I just think about like our journey there, and like now there's someone else in there having to endure that, and I hate that for them. Yeah, it's just been ongoing, and I think there's still a lot of healing that needs to happen. But
so what does that look like for you?
For me, that is, I'm getting to stay home right now with her. I'm going to counseling, therapy. I think medicine is incredible. I don't think I would have been able to get through a lot of this if I didn't have medicine. And just, I feel like I've finally been able to like breathe and not worry. Like, I'm not worried about the PDA in her heart closing. I'm not worried about her lungs. Like, anything we have to deal with is, oh, we just got to go thicken a bottle. We have to do this. Like, nothing is, knock on wood, nothing is scary right now. Like, it's just normal. So, and I'm like still on that healing journey. There's a lot of trauma to work through, and a lot of trauma that happened in the NICU that I still have to work through. But I think it is.
How many
like
surgeries
amazing.
in total did she have?
3 so far.
Okay.
We've had 2 eye surgeries and 1 surgery on her esophagus.
Okay.
Nothing else planned.
Okay.
Hopefully, knock on wood. But that's, yeah, so far. And then they've told me, like, if her hemangioma doesn't go away by the time she would start kindergarten, then we can look into plastic surgery to, like, tighten that skin up and remove it.
Okay. But developmentally, like, her lungs and heart and everything is...
She's developmentally, like, essentially developmentally on track for her adjusted age, which is...
Wow.
A miracle.
Wow.
Like, you see her,
Incredible.
she's crawling, or
Yeah.
she's crawling, she's standing, she's babbling, she is just doing everything she needs to be doing. Like, we're going to speech OTPT 5 times a week.
Oh my gosh.
And so she's just working so hard and like doing what she needs to do, and it just makes my heart like swell with how proud I am of her, because there was a point where they were like, she may have cerebral palsy, she may have this, she could be blind, she only has a 10% survival rate. Like, just
so many unknowns.
Yeah.
And
so like
now you probably kind of feel like you just have a
I do.
normal baby, and
I do. Yeah. And so that's why it's hard. I hate when people act scared of her. Yeah. Because she is not scary.
No.
What she went through was scary.
Yep.
But she is not.
Yeah.
Does she have some, like, we have to thicken milk? Okay. That's easy, though. Like, that's easy.
Yeah.
But she's doing everything else a normal baby would do.
Yeah.
Yeah.
So, since your journey, have you connected with a lot of other NICU moms, or how is that
kind of
for you?
Okay.
Or are you kind of not there yet in your healing, I guess?
I think if someone was starting their journey right now, like where I was a year ago, I would want to talk to them and say, like, this is going to suck. And there's no way around that, but you can do it. The days are going to suck, but you are going to do it every day. You are going to show up every day because you have to. And, like, let them know that it's okay to cry your eyes out. It's okay to, like, to struggle and to not want to get out of bed and all those things, but you have to keep showing up for them and holding them and loving them and talking to them. I'm in some Facebook groups.
Okay.
But sometimes it's too much. Sometimes I just got to scroll past. Like, I can't.
Sometimes it just brings it back.
It's too hard to, it's too hard. And I just have such a place in my heart. Like, I want to, like, do things for the NICU. I want to donate quilts up there to give. I think every baby should have, like, a little bit of something special, like handmade over them. Like making snacks and stuff for the nurses. And I don't know if that, like, fully answers your question, but
Absolutely.
So do you ever bring her up there?
Well, she can't go back.
But do you bring her up there, like, to see the nurses, or do you see the nurses outside of?
I am friends with a lot of them on social media. I've met up with some of them outside of of it, and so they love seeing her.
Yeah,
because we were in the same spot for I think 113 days.
Okay.
And so like that's just Blair's spot.
Yeah.
And I love them. I adore those nurses at Baylor Scott and White, Fort Worth. Y'all's NICU is the best, better than Cook's. I said what I said. So I'm gonna bring up some goodies and snacks and stuff for them for her birthday.
Aww.
And drop them off and just like talk to them. And then they have NICU reunions.
Okay.
So we'll get to go take her to NICU reunions and go see all of our different people.
Aww.
Yeah.
That's awesome. That's really cool. Wow.
Yeah. So her story is crazy. Like the faith that we've had to have is crazy.
Yeah.
Yeah.
But she's such a little fighter.
But see, I'm a fighter. I'm a big girl.
You're 1 year old.
I'm one. I'm just a 1-year-old baby girl. Yeah.
She's so cute.
Just such a happy girl. Who
Yes.
sleeps through the night, who is just a sweet baby. Yeah.
Say, I made it through so much. I have so much to say. Aw.
Yeah. And that's why I reached out to y'all, because I think her story is so, I would be doing a disservice to her if I didn't share what we went through together. Because we did, and we're still going through it.
I feel like it's important. I don't think people talk about it enough. You just see a lot of people, they have a normal birth, normal babies, and
yeah. I would say, if I could give advice to other people who are surrounded by, or anyone who wanted to support someone who was going through this, their journey does not stop when they leave the NICU. Did you bonk your head?
It's okay, you tough girl.
And I feel very firmly about that. The financial strain is still there. The stress and anxiety is still there. Even after the initial, we had our baby, and people want to do a GoFundMe, they want to support you, but it is still there 3 months later, 5 months later. Hey, I know it. So you have to continue to show up, even when you're I'm just gonna bug them. I don't. This is too much. They don't need me to text them. Just text them. Hey,
Just check in.
Bring lunch. Go get, say, let me go take you to get your nails done, because you're not doing any self-care for yourself right now.
Right.
Yeah.
The journey doesn't stop just because we're not in the hospital.
Yeah.
Yeah.
It's true.
Yeah. So my mom, oh my goodness, incredible woman. When this happened, she moved into a fifth wheel trailer and lived in White Settlement for the entirety of our journey.
Wow.
Literally uprooted her life, moved there, worked remotely out of her trailer for that long, and she went to the NICU every morning at 6 a.m. and sat and talked to Blair, and then she journaled every day. So we have that journal, and I would read it every day. She would journal, and I'd be like, I'm gonna take a peek at what that has to say.
Yeah.
Because it's sweet. All this stuff was so sweet. And I have a little excerpt that I wanted to read of something that she said.
Oh my gosh.
And her catchphrase this entire time, because we went from being worried about her to being worried about lungs, heart, brain, all the things. And so she would say, my God that can move mountains can fix a tiny heart. My God that can move mountains can help Blair see. And she has just stood by that and said that every single day, wrote it down every day, manifested it, prayed about it, and believed it. Because there would be a lot of times where I would be just breaking down, I am struggling, and she would just say my God has this. My God that can literally move mountains, shape the world, can heal Blair. And there was So she had a PDA, which is like a tiny hole that's supposed to close in utero.
Mm-hmm.
And we were going to have to get transferred from Baylor way earlier than I would have wanted to. And they treat that with Tylenol. The first round of Tylenol didn't work. Second round of Tylenol did work. And it was actually Kaylee again. She came and told me, she said the PDA is small today. Mm. And we were like, what? Like, it had been large, and we were going to have to go have a heart surgery and get a catheter placed to, like, seal it together. Yeah. And she said, it's small. Y'all don't have to leave.
Wow.
Like, you get to stay here now.
Yeah.
And so just so many God moments, like, showed up.
Mm-hmm.
Running into an old man in the elevator who said, oh, I'm 75. I was born at 24 weeks, too. Like,
wow.
What do you mean?
Mm-hmm.
What?
Wow.
We just had, both of us, like, so many God moments that you're like, why am I running into you right now? Mm-hmm. Like, why are we having this conversation? You don't know anything about me, but it means so much.
Yeah.
And I want to read, like, what she wrote. Because it just, like, makes my heart so happy. Because she would go every day, and you start to learn what's going on with the other babies there. Obviously, no one's telling you, but you can tell.
Right.
And so she wrote, when I come to the hospital and sit by your incubator, I imagine that the squishy little bed you are laying in is God's mighty hand holding you. Mm. I pray for him to hold you, and I ask for his hand on all the NICU babies. Here you go. Oh. I know many of them may not have the same family that you are going to have. And then she wrote a verse down. The Lord is good, a refuge in times of trouble. He cares for those who trust in him. Nahum 1:7. And so she would do that every day. And, like, the next day was 10/2/24, day 50, 1 pound, 14 ounces.
Oh.
My God that can move mountains can protect a tiny brain.
Yeah.
And so we just have a journal filled with 200
That's
days
so
of
special.
that.
Wow.
And that, like, persistence.
Yeah.
So it was just incredible.
Mm-hmm.
It's incredible that your mom, she showed up in the ways that you couldn't in that moment for you.
I mean, she showed up and took care of her baby while I was taking care of my baby. Because I would go to her camper and have lunch with her and take a nap in the trailer, and just, like, she would take me to go get a massage and go get my nails done, and, like, trying to take care of me. And then my dad came in every weekend while we were there. My brother came in all the time to see her. Ty's parents drove an hour round trip to see her every, like, 2 or 3 times a day, or not a day, a week.
Yeah.
I was up there every single day during the day. My mom was up every day in the morning, and Ty would come in the evenings. And our nurses said, we've never seen a family show up like how y'all did for Blair. We've never seen that many people come for a baby before. And I think, like...
Can you hand me a tissue?
I think, like, that just shows, like, you have to show up for them because it's going to make such a difference.
Yeah.
And, like, the bourbon. Like, you can't tell me, like, God is not working and literally moving mountains for those babies every single day. And everything that they do, it's incredible.
Yeah.
Because there are some things that medicine has done a lot of, but then they're, like, you're telling me that we had been struggling with getting her PDA to close, and then all of a sudden it was closed.
Uh-huh.
I don't understand.
Yeah.
And she went through all this trauma, and she never had a brain bleed. She never had anything wrong with her brain.
That's amazing.
Yeah.
Wow.
Special.
I think she's just such a testament to that. And I don't think, like, we're, like, our case is special at all.
Yeah.
Like, I don't think God said, oh, I'm going to make this Blair's story be more special than all the other babies. I just think, like, I want to share that with people who are struggling.
Yeah.
Because I don't know how many times I cried in the parking lot. I cried on the floor, just being like, God, just please be with me. Like, this is hard. I have never gone through something more hard in my life. Like, please just be with me. I just need you here. I need you to hold Blair. I need you to wrap your arms around her.
Yeah.
And every baby in here, because I saw a baby, that's the thing is, I have trauma not even from her.
Yeah.
Just what you saw when you were in there.
There was another baby who was born super early, because they have a whiteboard that has everyone's last name on it, so you know like what nurse is working with what babies. And so you get just so used to seeing those names. And there was a baby, I'll call him baby R. I had seen all of his jet settings. Like I knew kind of how he was doing because I could see all those things. And like I had already learned so much about Blair. And we went and visited Blair one evening, and Ty was back there, and he said his vitals went to 0. And nurses are flying, taking care of him. And so then they were asked to leave. And his mom, baby R's mom, rushed in because they had to call her to say, your baby's struggling, like you need to come right now. And just watching that mom, I'm in the lobby watching her run to the microphone and saying, I'm baby R's mom, please let me in.
Yeah.
And then after, because I stayed, they had all left, I had stayed because I hadn't gotten to see Blair yet. I was waiting to get to go back, and he passed away. And the chaplains were back there, and our nurses were back there, and the next time his name wasn't on the board. Like that baby who I don't even know that his name is not on the board anymore. And to think like that could have been us at any second, at any time. And they had to go and bury their baby when they thought that he was doing so good. Yeah. And
losing kids are babies, children. It's literally the hardest thing in the medical field just because it's different, like in surgery, right? When you lose a patient, like it's different when it's a person that you know at least has lived a life.
This is baby
you know what I mean?
Who never got to have fresh air on his face.
Yeah.
Who never got to feel the sun.
Yeah.
Who you never got to sit in bed and hold them and love on them. And and I think about them a lot. And I never like met that mom. I never introduced myself or anything, but I think about them a lot. And I think about, it was another Kaylee who was that baby's nurse. And I remember seeing her and then she's having to take care of other babies too. Right. And I remember the chaplains being like, we need you to fill out this information. And she was like, I can't. I have to take care of this baby now.
Yeah.
And then I remember the next day she was our nurse. And I was like, I know you can't tell me anything, but I want you to know that I have been praying for you. And that, like, I know what you went through, and you just have to come the next day and put a smile on your face and pretend like it didn't happen. And her eyes like welled up, and she was like, thank you. Like, because you want all the babies to get out of there. No one wants to go to the NICU. Every mom in there did not expect to be a NICU mom. No one wanted to be there. And we've all been thrown in and just had to learn.
Yeah.
So where did you stay? Because that brings up like a good question. Because I know that they won't allow you to stay in the hospital, which I wish that they would let the mom stay, because like what if that happens?
At Cooks you can.
Okay.
There's a bed. There's like showers and all those things. Okay. At Baylor, it was just open 24/7. So like you technically like weren't supposed to sleep there.
But
I fell asleep in the recliner a lot. Like I would just pull the curtains and like, so we were kind of sectioned off. But we lived in Weatherford, so I would just go home every day.
Okay.
But then I think about the people who don't. Like if I lived in Abilene.
And you had a transfer.
Yeah. You could stay in Ronald McDonald House, which is right there.
Okay.
But there's just so much like food. Like we spent so much money on food, and I would literally go and pick up like McDonald's and eat that on the way there. And that would be my food for the day. Yeah. And she got approved for a lot of stuff with insurance. So our bills aren't crazy. But I still have bills from my time in the hospital, and like the financial burden is crazy.
Mm-hmm.
Yeah, I can only imagine.
Was your insurance and stuff through
my work
as well?
And I didn't go back to work. They at my school, they were amazing. They I was still getting a paycheck, but it was $0, and then we paid back my insurance.
Okay.
So they let me stay.
That's amazing.
On insurance.
Wow, that's.
But then she got approved for Medicaid. So we don't really have any bills. But at one point, I got an estimated, like a benefit estimation, or like, I guess basically a receipt.
Okay.
And we had only been there for 75 days, and it was $1 million.
No, it
was every time they poked her to do her blood gas, it was $500. Isn't that her setup? Was $2,500 a day to have the jet ventilator at her bedside.
What do people do if they don't have insurance?
And
it's not something you ask for.
No, it's not something you want. Like, no. I don't want to be here. Yeah, tell them. And we were there for 195 days and had a transportation to Cooks and had surgeries and specialist after specialist. Like, if I were to see like a full list, I guarantee it would be over $3 million. And then like everything we're doing now still crazy. Yeah. But she only qualified because of her low birth weight. You have to be under a certain birth weight to qualify.
Okay.
But think if you were like just a couple grams above that, and then you have to pay for all this? No.
Yeah.
And then you have like your maternity leave ends, and you have to go back to work. I can't imagine going back to work. Mm-hmm. And then what about when baby comes home? Do I just not get maternity leave? Or do you split it up? Mm-hmm. There's a lot of legislation that needs to be reevaluated, looked at, taken into consideration. Because it's crazy. The system is crazy.
Yeah.
Yeah.
You have so much to say about it.
Tell the people. Yeah. Tell them. Say, I don't like that insurance stuff.
Insurance is
it's a beast in itself.
Yes. Absolutely.
Yeah. And I spoke to lots of social workers and stuff about all that too. Yeah. And so like now we have it figured out, but in the beginning it's terrifying because you're like going through all this and then you're having to file all this paperwork. What? I mean, I think you just have to, like, yes, I'm not like freshly postpartum anymore, but to still be understanding of the trauma. Mm-hmm. I love that for me. Understanding that like maybe I can't give my all to everything anymore. And I want to give my all to everything, but when I try, like, I just can't.
Right.
Yeah.
And recognizing that as other people and not getting offended, maybe is the right word.
Yeah.
Right. Well, you have other priorities and your life has changed.
Yeah. And people who haven't gone through that don't understand, and I would never expect them to understand.
Yeah.
It's just hard.
Yeah.
Like, going through this is hard, and some days are great days, and some days are still bad days. And are still scary, and like, I can't predict when that trauma is gonna like resurface. Yeah. That's crazy. And I hope it's things that I hope she doesn't remember any of it one day. I mean, and she has scars. Like, she has heel prick scars on her feet. But there's nothing on her or anything that, like, says I was a NICU baby.
Right.
Like, I am less than, like,
yeah.
I will say, too, while we were going through that, I had a really hard time being around other pregnant people.
I'm sure.
And, like, being happy for them and seeing, like, announcement pictures or, like, oh, we're pregnant or whatever, because I wanted to be pregnant so bad that it was really hard. Or they would say, like, because the common thing, how far along are you? Like, when's your due date? And they would say, oh, I'm 30 weeks. And immediately in my head, I would go, okay, you were 7 weeks. I would have already like Blair would have already been alive for 7 weeks.
Mm-hmm.
Or, oh, I'm 12 weeks. Okay, well, in 13 more weeks, you're going to have a baby. Like, or, like, and it was so subconscious that I hate that I would do that. And I still do that. I don't think I'll ever be able to not do that.
Yeah.
But it just, I had so much envy and jealousy that I just couldn't cope with, because I wanted to be 40 weeks pregnant. I wanted to have the beautiful labor and pack the bags and we never got to, and it was just abruptly over. Abruptly, we had a baby, and I'm not pregnant anymore, and this is our life.
Yeah. Wow. So what is, like, thinking down the road for you, like, how do you plan to kind of help Blair and remind Blair of, like, how much of a fighter she is, and, like,
that's a good
what
question.
she overcame?
My mom has her journal. I have a journal that I wrote in.
I think that will be one of her most treasured.
Oh, my goodness. To see in writing, like, how much
you were loved and prayed for.
And that's powerful. And I have, it's one of the pictures that I'll probably send you of, instead of like a normal newborn session, we never got that, obviously. We did something when we left. And I have all of her memorabilia. I have all of our journey beads. We got a bead for every day we're in the hospital. All the things that our nurses made for us, and I have all of it.
Yeah.
And so those are things that I want her to have one day. Yeah. And to look back on and go, was I really that tiny? Yeah. You were really, really little. You didn't open your eyes for a long time. You were like a little puppy.
And we have to talk about the Taylor Swift outfit.
Oh, we have to. I am a very crafty person, and I, like, really dove into my, like, crafting, sewing while she was in the hospital, because it was such a great outlet for me.
Yeah.
And I literally was like, she needs to have a Halloween costume. Like, I want her to do something fun.
Did they do that? They did that across the NICU.
Oh, yeah. Yeah. They do it at, like, I think they do it at every NICU, honestly. And if you don't bring a costume in, then they have some, like, little pumpkins and bees and
so they, like, encouraged you guys to make them and
absolutely
choose. Oh, I love that. I didn't know that. I just thought that they just randomly, like,
no
made them. They're like, we're gonna make this. I didn't know.
It was like a day. Like, this is like, it was on Halloween. Like, okay, everyone gets their costumes and gets their pictures made, and they do it for everyone who, like, signs the waiver or whatever.
Yeah,
that you get to have, like, your picture taken with the baby, and it was super fun. And so I, out of a piece of felt, I, like, made a little corset, I guess, and then bedazzled all of it to look like her opening number. And
it was so cute, and like it literally looked exactly like Swift's.
That's what I want to do this year, is get a real onesie and bedazzle it.
That'd be awesome. Oh my gosh, yeah.
So I had, like, made that TikTok just because it was fun.
Yeah.
And I think I started out by saying, like, well, you can't buy a micro preemie onesie, on Amazon, so I guess I'll make one.
Yeah.
Oh, did that hurt? For just a second, you're getting baby.
Oh.
And so, I made the whole thing, and we went in, and our nurses were like, I love this so much.
Yeah.
And so we put it on her, and, like, the people on TikTok were like, I can't believe you put tape on a baby. And I'm like,
there's tape on them all the time with their
lines.
faces. Yeah. Like,
there's
literally
so much tape
everywhere.
And we just, like, used the tape to, like, stick it to our little feet, because I made like boots too. And it just, like, blew up. It was crazy.
Amazing.
And then I still have that, and I hung it up like at her bedside even after we had left. And
you should frame it.
Oh, that's such a good idea.
You should frame it and put it in her room.
You should.
That's a good idea. Maybe we can do that. We can do that.
Little Taylor Swift.
Because even at Halloween, my doctor, he looks like Santa. Like, he literally looks like Santa. And he would dress up as Santa and take pictures with all the NICU babies, and they would pass out stockings. And so they try and...
What a good doctor.
Yes. He's amazing. He does it for all of the hospitals, or like he does it at Baylor, Cooks, and Harris.
Okay.
And goes and takes pictures with all the babies. Like
so cute.
And so they just try and make it a brighter place because it can be so hard sometimes. But we had a lot of wins too. We had a lot of great days there.
That's awesome.
Yeah. You being crazy pants.
So looking back, like what has Blair taught you about strength and about motherhood?
To continue to show up every day, having to show up, even on the hard days. That bad things can happen to good people. And we went through something that was bad and really hard, but like it was just a blip in our story. And now look at us. Like now look at this perfectly happy, healthy little girl who has been crawling around and causing a ruckus all morning. And I always just kept thinking, like, if Blair can do this, I can do this. If Blair is having to get poked 20 times a day, I can do what's hard.
I love that.
Yeah, because she didn't ask for any of this.
Yeah.
She never wanted that. But she still endured every day and fought, because some babies don't fight. And she did. She was very feisty. Yes. And she fought for her life in the NICU.
Because I'm resilient.
So, like, what a disservice it would be of me to not continue to fight and advocate and share our story about her incredible perseverance, like that she still has. We go to 5 therapy appointments a week now, and on top of that, other doctor's appointments and other things. Like, and she endures and is so happy about all of it. Yes, and is literally moving mountains every day. Yeah. And doing things that we never thought she would do.
Yeah.
Like, yeah, is that funny? And I hope one day she gets to have a beautiful life. I hope she gets to have babies one day, and that she gets married and can continue to tell her story, because it is something that is going to continue to evolve and grow. And I hope that one day we can look back and say, wow, we were there almost 200 days. Like, that feels so long ago, and I can't believe we did that. And now look at us.
Yeah.
Because I think that, like if she's 1 year old, we just started all this 365 days ago.
Yeah.
Never, if I could tell myself, if I could go back and tell myself, you are about to go through this, but y'all are going to make it out. You are going to thrive. And it may not feel like that every day, and you're going to make really, really big changes in your life. You're going to quit your job. You're going to move out of your house.
Well, think of Joseph in the Bible, like what he went through and endured to become king, And I mean, if Jesus told him, and like, hey, these are all the horrible things you're going to go through to end up here, like, would you have done it? Or is it, just fighting in the moment of like, okay, this is the card I'm being dealt right now. How am I going to handle it? And grow from it, and move to the next step. I think it's amazing.
Yeah.
So
I would love to just say, like, you can do it.
Yeah.
You don't think you can, and you think it's going to be way too hard and that you're not going to make it through, but you are going to do it, and you're going to, like, impact other babies and other families, because no one expects this.
Yeah.
You never expect to have to endure something this traumatic and horrible. But Blair is just a living testament that you can, and you can thrive, and you can be happy, and even when you've gone through something horrible. Because I fully think, like, she will be up and running, and we'll figure out the rest of this eating stuff, and maybe we have to stay on thickened foods a while, and that's fine. Like, that is okay. But she's going to be talking and walking and running one day. And I never would have thought that on day 1.
Yeah.
I honestly never would have thought we would have made it to day 2. you going to get that?
It's incredible.
Yeah.
Kinsey and Blair, thank you guys so much for coming on. Thank you for reaching out to us.
Yes.
We seriously, like, this has been so moving in so many ways, especially for me, and I know Sarah. And we appreciate you sharing your story. And
your
Blair is
testimony.
Incredible and resilient, and she's gonna do so many great and big things in this world.
So many. Yes.
She is. Maybe she'll grow up and be a NICU doctor. Be a NICU.
That would be
a NICU
so
nurse.
special.
Yeah.
Hey, happy birthday, sweet girl. Happy birthday. Happy birthday. Oh, thank y'all so much for coming on.
It was great. I had so much fun.
It was fun.
Yeah.
Say bye-bye. Say bye-bye. Say bye-bye.